Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Vaginal discharge. Vaginal discharge is a common complaint seen in the primary care office. The diagnoses that must be considered include normal discharge, vaginitis, sexually transmitted diseases, and urinary tract infections. The commonest causes are normal discharge and infections of the vagina, or vaginitis. Normal discharge is usually milky white or clear and is a result of secretions from cervical glands, transudate from vaginal mucosa, shedding of vaginal and cervical epithelial cells, and normal resident bacteria. There is no odor. There is no itchiness. Infective vaginitis. Vaginitis is an inflammation of the vagina that can result in discharge, itching, and pain. The cause is usually a change in the normal balance of vaginal bacteria or an infection. The commonest causes are Gardnerella vaginalis, a bacteria, Candida albicans, a yeast or fungus, and Trichomonas vaginalis, a protozoa. Diseases not to be missed are sexually transmitted diseases. Of course, sexually transmitted diseases, STDs, must not be missed when evaluating a discharge. A vaginal discharge may be a presenting symptom of both chlamydia trachomatis and Neisseria gonorrhea, STDs. But chlamydia may not present with a discharge. The physician has to consider cancer in the genital tract. This may also produce a discharge. And the physician must also consider HPV or human papillomavirus. It can also cause a discharge. And finally, PID, pelvic inflammatory disease. PID is not a specific STD. Rather, it is a complication that can develop following multiple different STDs, particularly gonorrhea and chlamydia. In PID, bacteria spread to the uterus and female reproductive tract. Infertility may result if the condition is not treated right away. Pelvic inflammatory disease symptoms include fever, pelvic or low abdominal pain, painful urination, discharge, painful intercourse, and light bleeding. Who's at risk for STDs? It's estimated that half of sexually active young adults acquire an STD by age 25. In fact, STDs are the most common type of infection in America. While STDs are more common in teens and young adults, anyone who is sexually active is at risk. The risk is raised by having multiple sexual partners. The incidence of some STDs, including LGV and syphilis, is rising in men who have sex with men. LGV is lymphogranuloma venereum. It is a long-term, a chronic infection of the lymphatic system. It is caused by any of three different types of the bacteria Chlamydia trachomatis. The bacteria are spread by sexual contact. The infection is not caused by the same bacteria that causes genital chlamydia. Syphilis. Syphilis is a common STD. Syphilis is spread through vaginal, anal, and oral sex. Syphilis causes sores on your genitals, called chancres. The sores are usually painless, but they can easily spread the infection to other people. You get syphilis from contact with the sores. History. During the history, the physician will want to determine the characteristics of the discharge, its odor, its color, the amount of discharge, its relationship to the menstrual cycle, sexual history, previous history of STDs, patient's partner or partners, and any history of a discharge or irritation previously, the patient's use of soaps or douches, the patient's current drug therapy, and whether or not the patient has a history of diabetes or a recent urinary tract infection. The physical. The physician will have the patient change into a gown and lie on the examining table. The patient's feet will be placed on the stirrups on each side of the examination table and the patient positioned for the examination. A speculum will be used to examine the vaginal area and cervix. The physician will also examine the vulva, introitus, and urethral meatus. The physician will look for a discharge, as well as genital warts, polyps, a prolapse, or fistulas. The investigative tests that the physician may use are a wet mount. A wet mount will usually be done. This simply means that a drop of the discharge is placed on a slide with a normal saline solution and on another slide with a 10% potassium hydroxide solution. Each side is examined with a microscope to determine the presence of organisms that may be responsible for the discharge. If the presence of responsible organisms cannot be determined, then the discharge will be sent off for culture. A full STD workup will also be done. Swabs will be taken for Neisseria gonorrhea and Chlamydia trachomatis. A pap smear may also be done, and viral cultures may be taken. Well, I think we'll stop this video here and continue on the next video. I hope this helps. Have a good day.